it comes to blood transfusion, it seems as though we have not really understood, in that we've never done the basic research to know when we're doing good and when we're doing harm.
Transfusion alters a lot of things in the organism, and it has long-term side effects.
The recurrence rate is anywhere from 2 to 3 times more recurring cancer if you give blood than if you don't give blood. So that's a very frightening situation for those who go for cancer surgery.
You give a bag of blood, and the bag of blood has all sorts of things in it, and you ignore them.
Blood transfusion has never undergone randomized clinical trials to the level at which a new drug would have to go through the FDA. It's never been done.
Many clinicians think of blood and blood components as a drug to treat specific conditions that patients have. In fact, blood is an organ. It happens to be a liquid organ. This happens to be the only transplant that all you require is essentially a couple of letters behind your name and a pen, and you can write for it.
They know not what risks and benefits they're likely to create or cause as they give this therapy. They've been essentially brainwashed by a public relations event that's gone on since their birth.
И в Америке, и в России есть врачи ретрограды, которые за то, чтобы переливать кровь. И есть те прогрессивные, которые говорят, что надо все больше и больше отказываться от переливания крови. А критерии к этому, наверное, да не наверное, это точно, и у вас, и у нас сейчас одни и те же, которые вытекают из доказательной медицины, что надо отказываться от переливания крови.
Every decision I make as a physician should, you would think, be based upon my in-depth weighing of the evidence of I'm going to do more good than harm if I take the following therapy.
Avoidance of transfusion, as well as or the possibility of reducing exposure of patients to allogeneic blood certainly helps, if you will, restore some confidence by patients that they're going to get the best care.
We as physicians have all taken a very basic oath, and that is a Hippocratic oath, and it's to try to do good for mankind, and it also has the corollary of first do no harm.